Yeah, I think the first thing to know about people on hunger strike is this can be a very complex issue, both medically and ethically. But it's also an issue that has been widely discussed, very deeply deliberated upon by medical professional associations, both in the US and internationally. And they really emphasize a few things. And I think number one has to be that we don't use medical interventions as punishment. So we don't force medical interventions on people who have capacity and are saying, no, I don't want that. So the first principle of all medical care really is the principle of informed consent. So if you have a patient who has capacity to make their own medical decisions, you really cannot intervene on that patient against their will. The second thing I think to know is that the assessment of capacity really requires that you trust the person that you're interacting with. So it can't be the job of the facility director. It's the job of the clinician, of the doctor, to decide whether someone has capacity or not. And that can be really difficult in these circumstances because it's possible for the patient who's starting on a hunger strike to want to be able to tell you, I actually would be willing to be force fed, but I don't want my compatriots to know. So those kinds of issues can make this very challenging. But certainly they're never going to say that to a facility director. They need to have a medical team that they can trust. And then the third thing that I think is really important is these are medically complex cases. By the time someone starts to lose their ability to think well because they're so starved, they're actually quite a ways along in the process. So you really need expert clinical care. You should not be declaring that someone has lost capacity and force feeding them while they're still in an ICE facility. They really need to be in a hospital at that point, if they're at a point where they are so starved that they are losing their capacity. And then I think the other thing that we really wanted to emphasize in this paper is doctors do not have to face these issues alone. This is not unique to this issue. If you get asked to do something by your boss that you believe to be unethical, number one is know the ethics. So I think it's useful for clinicians to know the ethics of the American Medical Association, the ethics of the American Nursing Association, and so on, to make sure that you are acting in accordance with your professional standards. Number two, if you think you're being asked to do this and it's wrong, it's probably also the case that you've got some time to figure this out. This is not an emergency. People who are in detention and choose to go on a hunger strike as a protest are not going to be in danger of their lives immediately. It takes time. So you want to sit with that person, talk to them about the medical implications of what they're doing, of course. But then if you're not certain where to go next, you should seek counsel. You can call your medical association, the state medical association, or the American Medical Association, or the American College of Physicians, or whichever, the American Academy of Family Physicians. You can go to your professional societies for additional support and guidance. Most hospitals will have an ethics committee. You can go to an ethics committee for local support and guidance. And I think you, at minimum, the ethical standards on this are that at minimum, you need one other independent physician to help you with the capacity assessment if you're contemplating force feeding someone against their will. You need to be absolutely sure that the person does not have the legal right to refuse medical treatment, which in general they do if they have capacities. Well, I think we did hear in the context of doing this report, we heard from physicians and other clinicians at local hospitals and clinics who had been approached by ICE facilities in the area to help them with this. So I think it's important to recognize there are both broader implications of this as an ethical issue, and it is possible, even if you do not work at an ICE facility, If you work in a local emergency room and you've got a nice facility nearby, you may end up being faced with one of these dilemmas. So it is maybe more important for people to recognize this right now, and to recognize that this may seem like it's an esoteric issue that only affects a few clinicians. But the general issue can affect more clinicians than you may think. And also, the broad concern here is that we all recognize the importance of patient rights, and that individual, human beings who have legal capacity to make their own medical decisions, you can't force medical treatments on them, even if you think it's a good idea.